Let's go. All right. Hey, we are here with Doctors at the Park. I'm Dr. Thanh Mai at Insight Vision, and I'm joined today by Dr. Omar Krad. And I want to just have, you can just tell us a little bit about yourself and a little bit about your practice, where you're practicing, what kind of ophthalmologist you are. He's an ophthalmologist, and one fun fact about you. How about that?
Hi everyone, my name's Omar Krad. I'm an ophthalmologist. I specialize in cataract and refractive surgery. I've been in Orange County for 14 years. I moved from Chicago. I came to California because of the beautiful weather and the scenery. I mean, it feels like June, but it's February right now. And I recently opened a new practice in Fullerton, California. I just started like 3 weeks ago, so I'm super excited about that. And my passion is giving hope to scared patients, because I feel like when patients are going to have surgery, they're often afraid of the procedure, afraid of the unknown, afraid of losing something they can't replace, their vision. And I love making the process easy for them and reassuring them and giving them an outcome that will last a lifetime. And so I named my practice Hope, because I love giving patients hope. And also my wife's name means hope. It's translated to hope. And you know, what's better than hope? You know, in any situation, if you have hope, you've made things better. And so I have 3 lovely children, and so I'm super lucky.
Excited to have them on the show.
I think instead of dividing ophthalmologists and optometrists into 2 teams, we really should be just on team patient.
Yeah.
And what's best for the patient.
100%.
Ultimately, there are a lot of ophthalmologists who would say they would never co-manage. But meanwhile, in their office, they have a couple ophthalmologists, they have a couple optometrists who they are co-managing with, really. It's a different system because they're all under one roof. But in reality, what they're doing is they're doing what's best for the patient.
Yeah.
And I think what gave co-management a bad rap, at least in the ophthalmology world, were big corporate practices setting up relationships with different optometry offices around the country in exchange for referrals.
Right, yeah, sure,
And so that unfortunately damaged the reputation of that relationship, you know? And we all see patients, and if I get a patient, even before I ever co-managed anybody, I would always, out of respect, if someone sends me a patient, I send it back. It doesn't matter if they're a primary care physician, an endocrinologist, or an optometrist. Like, I'm the cataract and refractive surgeon. If I serve the patient with their cataract surgery, of course it makes sense. After they heal, I send the patient back. I don't want to like keep a patient that has been seeing their primary eye doctor for 10 years. It doesn't make any sense.
Yeah.
And so I think we have to focus on what's best for the patient and let the patient lead. If the patient wants to see me, great. If they want to go see their primary eye doctor, great. If they want to see a new doctor, great. Like, let's do what's best for the patient. And I think as long as we have that same expectation out of the relationship, then we would work much better together.
100%.
Because we're not expecting something in return. All you're doing is something for the patient, whatever's in the patient's best interest. I think unfortunately the waters have been muddied from previous behavior of setting up or expecting referrals for co-management,
right?
Which is not what it should be, right? And so I feel that right now, starting a new practice in Fullerton, I have some patients come to see me from an hour away, from Dana Point, and for me, I'm like, man, I never seen this perspective before, where I actually want the patient to have an option next to where they live during their post-op recovery, right? You know, and I never had that situation before, and so now it's very clear that it's good that the patient has an option, but ultimately the patient should decide. You know, my mentality has always been for the patient, I'm here for you, and I think that if it's better for the patient, more convenient for the patient, that they see their local eye doctor like a week after surgery, then great.
Yeah.
As long as, I guess one other thing that's important in co-management is that if I have a optometrist in my practice, we work closely together. I know their work. I tell them what I'm looking for during the post-op care. And so I think that relationship has to also be set with co-managing optometrists and their surgeons. You know, when I want to make sure that the patient is going to see their primary eye care provider and that optometrist knows what I'm looking for in the post-op period, and that there's open communication, you know. And I think it's important that also no matter what procedure a patient has, whether it's a basic monofocal lens or a premium or advanced technology lens, that the co-management option is there. I think it's not right to offer patients co-management only when they upgrade a lens or they get femtosecond cataract surgery, and then there's no co-management if it's a basic lens. I think if we are going based on the principle of what's best for the patient, we have to be consistent. And I think that if I am co-managing with somebody, it would only be fair to the patient that I'm not expecting something in return from the OD as well.
Right, yeah.
I am not naive enough to think that if an optometrist refers me a patient, I do their surgery, and I send them back, now I'm expecting every patient to come to me. Because that would be a relationship that's not putting the patient first.
Absolutely.
And I think it's fine also that doctors work with many different doctors. When I talked about corporate practices muddying the waters in terms of co-management, I think there's a pattern that, you know, the referrals are going in one direction, you know? And I feel bad for like the new grads, the new ophthalmologists finishing residency. They want to start a solo practice, and they have no chance to get referrals unless they are willing to go to the extent that big corporate practices are what they're doing with co-management.
Right.
And I'm not a lawyer, right? But I always try to guide my decisions based on what's best for the patient. And I don't want a lawyer telling me from a big corporate practice what they think is ethical, because oftentimes what they think is ethical is what they can legally get away with.
Sure.
You know, that's the definition of an ethical co-managing relationship. But I think, you know, what makes sense to me is that everyone is getting compensated for the services they provide and nothing more, right? So if you typically, for example, see a patient at your office and you have a certain fee schedule that you charge per visit, it would make sense that your care for that co-managed patient is equal to what you would normally want to get compensated.
Sure.
But when I think it gets muddy when it's like your normal visit is X amount, and then all of a sudden there's a co-managed patient, and now it's like triple the amount for the same service.
That
right?
happens? I didn't know that happens.
Well,
is that
yeah,
right? Okay,
it does happen.
Yeah.
You know, because it does happen, and it shouldn't happen.
Sure.
And I think that has to do with when co-management fees are decided. Very often, it has to do with it's supposed to be the fair market value.
Yeah.
Right.
Right.
It's supposed to be fair market value.
Yeah.
And so, you know, if you should try this experiment, you should be like, call an office and be like, hey, I just had LALs put in my eyes. I'm due for a visit 6 months out or something. How much is a full comprehensive exam, right? I think that number, whatever it is, should be in line with whatever agreed co-management compensation there is. And very often it's not in line, right?
Yeah.
And so I think that's important because ultimately every provider needs to be compensated for what they do, and there shouldn't be a compensation that is intended to generate more referrals.
Sure.
Right?
Yeah, absolutely.
That makes sense. I think everyone would agree with that.
Yeah.
And I think ultimately what's best for the patient is doing whatever is convenient for them and giving them the highest quality care. I mean, for me, up in Fullerton, when I have a patient come from out of state, because of YouTube, you know, YouTube's a big thing, right?
Yeah, absolutely.
And so I'm looking for doctors near the patient to be available. and to examine the patient and to fax me over records so I can see how the patient's doing. Because ultimately, I care about the patient. I want to make sure they're doing well. And I think if we do it that way, we'll clean, we will filter and purify the tarnished reputation of co-management with big companies.
Yeah.
You know? So I think there's so many people that I met that I've worked with in the past few years, managing patients post-operatively, and patients love it. I think as long as you're giving the patient the option, then it's great, you know, because sometimes patients will say, no, doc, I want you to see me. And I'm like, I'm here for you. You know, and if they say, hey, is it okay if I go to my other doctor? You know, and I'm like, of course you can, you know, just make sure that, you know, you ask them to send over records and stuff like that. So I think there's huge potential. I don't see any reason why we shouldn't work together. And I think the key to that is to put the patient first.
100% agree. I'm curious about your default method. So let's say a patient is new to you and you've never met them before, and they come in, they say, hey, you know, let's say they need, eventually they're coming for cataract evaluation. Yeah. Inevitably, you might find they have a dense cataract. Do you, but you know, they're brand new to you, they were not referred, but of course you're gonna ask who's your, you know, usually it's that optometrist they've been seeing for years. Do you actively seek out the optometrist and try to establish a co-management, or do you go, well, I mean, right now we don't have a relationship with them.
Yeah.
You know, they came to me, and what if the patient never expressed interest in that?
That's a great question.
Yeah, I'm curious.
And I'll tell you.
Yeah.
So usually whenever a patient comes to me, I ask them, have they seen an eye care provider before? Yeah. And I ask them, before I even ask their name, I ask, do you like your eye care provider? Because it's important. And it's not just eye care providers, it's primary care doctors.
Sure, yeah.
It's endocrinologists. It's all of them, because patients sometimes come to me and they say, hey, do you know a good endocrinologist? Do you know a good primary care doctor? I'm new to the area, I'm looking for somebody. Yeah. So I love asking patients who their providers are and what they think of them. Because then I'm like, man, everyone likes Dr. Mai. You know, so I had a patient the other day ask me, do I know of a keratoconus specialist? And in my head, I was like, yo, you mean for like cross-linking? That's me. Why would you ask me that question? It's me. But they were looking for somebody who does like scleral lenses, who does, you know, difficult contact lens fittings. Yeah. And then once, I actually did send them to you, by the way.
Thank you.
I said, once they clarified what they were looking for, then I knew, you know, send to Dr. Mai, Dr. Schramm, because I want to give the patient what's best for them, right? And if I didn't ask other patients before, hey, who have you seen, who do you like, I wouldn't know. So to answer your question, I always ask them who sent them and what they think of their doctor. And when I tell them, usually when patients are gonna have cataract surgery, they wanna know what's the post-operative routine, what's the schedule of post-op visits. And I let them know, I typically want to definitely see you the day after and the week after. I like seeing day and week. And then I let them know that a month out, they're gonna need, I'm gonna want them to have like a refraction. And I ask them, would you like to go back to your optometrist for that? Because they'll do a better job than me. I don't do refractions that often. And so I usually offer that. And usually they're like, yes, I wanna go back to the optometrist that they've been seeing for a while. Sometimes they'll say they wanna stay and have me check it. For me, it's like whatever's better for the patient. But yeah, that's what I do. And in terms of like co-management, you know, co-management has changed a lot over the years. And so oftentimes the patient doesn't even know what lens implant they want till the week before surgery. So they often don't know what they want before. But like I said, my feeling is that if co-management's going to be done, it really should be done no matter what technology the patient gets.
100%.
So.
I love co-management and talking about how we can develop better relationships with optometry and ophthalmology. I'm curious, what are, if you were to mentor a brand new ophthalmologist fresh out of school, what kind of tips, like, you know, that you've learned over the last 14 years in terms of establishing those relationships? What's like your favorite way of, you know, meeting more doctors and establishing that relationship? How do you communicate with them after you deliver, you know, after the surgery? I'm curious what kind of advice you'd give a newbie.
Well, in a way, because I just started my new practice, I am a newbie.
Hey!
Although I've worked in a busy corporate practice for many years, I'm learning how to do things from scratch. And I think if you go based on two principles, one, be useful. Be useful to the referring doctor, be helpful, and also be helpful to patients. So everything you do has to be with the intention of helping. And so, for example, let's say we're going to go meet some doctors and ask for referrals.
Yeah.
You want to make sure that you go in, first of all, with the attitude like, you're the new guy, so don't expect, you're going to get all the new referrals. But maybe say something like, hey, I know you probably already have relationships with other ophthalmologists, but I'm starting out new, and if you could potentially send me 1 or 2 patients a month, I'm going to make them your happiest 1 or 2 patients.
Ooh, I like that.
All right, so that's one thing.
That's good.
That because that way you're not coming across as like arrogant, where you're going to ask for all their patients and you don't want to affect or hurt the relationship that they've built for so many years. I'm a general ophthalmologist, do cataract refractive surgery. I, for example, refer out to retina specialists, and I send to many retina specialists. I don't just send to one,
right?
And so I think if the ophthalmologist is going to meet ODs and ask for referrals, they need to expect that. They need to know that they're not going to get all the patients, which is okay. You don't want to hurt the relationship that optometrist has built with other surgeons. But if you ask for 1 or 2 patients a month, and then you really try to treat those patients so well where the patients go back to that doctor and be like, wow, thank you for sending me to Dr. Krad. He really took time to answer all my questions. I was never rushed. I never felt like a number. I felt like he was treating me like family,
Right.
That's my personal strategy, because that's actually what I think every patient deserves. I think that for me, I'm passionate about educating patients. I'm passionate about delivering good care. I'm passionate about giving them time. I'm passionate about decreasing their fears. And so for me, that's what I want to do. And so I would advise a new grad or a new ophthalmologist in the area to do the same thing.
I love that, because I've had personal experience where an ophthalmologist actually emailed me and said, hey, what's going on? Why aren't you referring more patients to me? And it wasn't because I wasn't referring, I decided not to. It's just because I just didn't have any cases that month to send over. I just literally didn't hit my chair. And so, but it kind of turned me off, because he was kind of accusing me of like sending it to someone else almost. But,
I would advise them never to take it personally. When I go, and I've been going to office, interrupting the schedule. I feel bad for doing that. I'm not going to expect anything in return. And so if I go to 10 doctors and one of them starts sending me a couple patients a month, I feel that's a success. So I think that you have to set your expectations. Just like when you have a cataract surgery patient, you have to set realistic expectations for them, whether it's a multifocal lens or a basic monofocal, you have to set expectations. And so I think that if your expectations are unrealistic or too high, you're going to be disappointed. Are they bringing anything useful to either my staff or my patients? I felt like there was always pressure to do more, see more, bill more, and that came at the expense of quality care.
What do you see that is exciting innovations in ophthalmology that you're looking forward to coming in the next 5-10 years?
Let these eye doctors stick to eye care.
There it is. No, let's go. You caught that, right? You got that, okay.